Hello everyone. The condition that I'm covering is reactive attachment disorder. Reactive attachment disorder is a rare condition that develops during infancy and early childhood where children do not form healthy emotional bonds with their parents or caretakers. The absence of emotional warmth and attachment during the first few years of a child's life can influence a child's future by negatively affecting their physical, emotional, behavioral, social, and moral development. Although the exact cause is unknown, reactive attachment disorder may develop in the presence of pathogenic care. Pathogenic care occurs when the caregivers disregard a child's basic emotional needs. Reactive attachment disorder develops when a child's most basic needs for nurturing, affection, and comfort have not been met. This stops them from forming healthy relationships with others. Love and trust for others are not developed when a child does not receive comfort, affection, care, and stability from their caregiver or parent. Children are more likely to develop reactive attachment disorder if they experienced neglect or abuse, lived in foster care or an orphanage, experienced a traumatic loss, were taken from caregivers after bonding, or having consistent or multiple caregivers. Infants and young children with reactive attachment disorder may exhibit some of the following symptoms: withdrawal, no interest in toys or environment, not smiling, not reaching to be picked up by their caregiver, hiding emotions and feelings, and displaying aggressive outbursts towards their peers. As children grow older, reactive attachment disorder can take two forms, causing them to display inhibited or disinhibited behaviors. Inhibited behaviors cause a child to avoid relationships, whereas disinhibited behaviors cause them to excessively seek attention. Some behaviors commonly seen in the inhibited type are not seeking affection from caregivers, preferring to be alone, being more self-conscious, showing restraint, refusing help and comfort, and avoiding relationships. Some behaviors commonly seen in the disinhibited type are being overly friendly towards strangers, seeking out affection from others in unsafe ways, acting out without consciousness or restraint, requesting help often, and having anxiety. Children with reactive attachment disorder exhibit challenging behaviors that interfere with their daily lives. These behaviors negatively affect their social interactions with parents, siblings, teachers, peers, and therapists. These behaviors include need for control, lying, affection towards strangers, denial of responsibility, and projecting blame for their actions onto others. These children will likely experience difficulty in occupations of social participation, education, and play. Social participation will be affected because they have difficulty forming and maintaining healthy relationships, sharing emotions, and conveying feelings. Their educational performance will likely be affected due to challenging behaviors. Playtime with peers will likely be affected due to the inability to relate, communicate, and interact with others effectively. Without proper treatment, this disorder can last for a prolonged amount of time and severely affect the person's quality of life. Children with reactive attachment disorder are at higher risk for complications in childhood and adolescence that will affect them socially, emotionally, and physically. These include emotional problems such as depression, anxiety, PTSD, and anger management, trouble in school, problems forming and maintaining relationships, risk-taking behaviors, and delays in developmental milestones and physical growth. Children with reactive attachment disorder experience social, emotional, physical, and cognitive delays. They suffer from limited social abilities and limited emotional regulation. Low self-esteem often impacts academic performance and progression. The occupational therapist should consider the following aspects when treating a child with reactive attachment disorder. Having close and consistent collaboration with the child's family to facilitate successful outcomes, involving parents actively in treatment, helping children develop a secure sense of self, limiting the child's exposure to multiple caregivers, providing high levels of structure and consistency, and making specific, realistic, and attainable goals.